An example of something I'm actively working on is a problem I see in ACL patients is I can have 3 different patients. They're all 13-year-old girls who tore their ACL playing soccer, and their injuries are indistinguishable, and I do the same surgery on all 3 of them, but their clinical trajectories might be very different. One of them has no issues, one of them gets stiff and has more pain, and one may take longer to get back to sports than the other 2. And it begs the question of why. And until we start digging into the actual biology of it, I don't think we'll find the answer. So we've done a study here at OrthoCarolina where at the time of surgery, we'll take a little sample of the joint lining from their knee that we otherwise would have thrown away. And we looked at what are the cells in their knee doing? What are they telling us? And what we learned is that there's these white blood cells, which we think of as being inflammatory cells called T cells. And those patients that I thought would get stiff, turns out they all had really high levels of these T cells. And the patients that did great had really low levels of these T cells. Well, that may seem like a small discovery, but then the next step is, okay, can we change that? Can we modulate that? And we're in the process of trying to get a grant to understand if we change those levels of T cells before we do surgery, can we completely change this person's clinical course? And so basic science is not for the faint of heart. Again, it's usually years of effort to produce results, but it is so valuable. And without that basic science research, we become stagnant in clinical practice.